Let's look at session 22, fitness testing. The friends love this session. It's lovely and scientific, and it's applied science. So they're starting to use some cool gear, like blood pressure kits. They're using tape measures. So they're really getting into the nitty-gritty of assessing. Now in this session, it's going to be important that you have the key things dealt with enough time. Put enough time into the big three. The big three: heart rate, blood pressure, and girth measurements. You must allocate enough time for that so the friends can see how to do it properly, understand the basics of the assessment, and also understand how to interpret the results, because they're the things we're going to be looking for when we're working with them in their assessments. So this relates directly to the HIPPO assessment. They'll be using it again in the GALAR assessment, in Master Challenge. So in a number of assessments, these things are going to come up over and over again. Very importantly, when you're going through your explanation, the slides have got some good things on them. Talk to the slide, but then demonstrate. Best way to demonstrate is in a real scenario. So get a table out the front of the room. Sit yourself down as you would in a normal fitness testing situation and go through the test. So talk the friends through it. Importantly, be clear with your dialogue. So your dialogue will be in terms of, I'm about to take your blood pressure, you'll feel pressure across here, a little bit of numbness into your hand, I'll be putting a cuff here, and I'll be getting two values. So you work through what the actual dialogue that we need to see in the assessment is. And if during the session you talk along those lines, in your assessments we'll be looking for, you'll find that the friends will apply it a lot better. So they want to really role model off what you're doing. Now, when you get into the heart rate, blood pressure, girth component of things, a good way to run the practical is have blood pressure as one standalone section, girths as a standalone section, and heart rates as a standalone section. That way there's enough quietness in the room for the friends to be able to hear when they're taking the blood pressure. You'll need adequate a number of blood pressure kits, so you've got one between two. You also need to get back every kit that you put out. Every tape measure that you put out needs to come back. You're responsible for the equipment, so make sure that you allocate and then get it all taken back. During blood pressure prac, stop the group, have a quick talk about what you're seeing technique-wise, reinforce what they should be hearing. What that will do is it'll quieten the group down. And that way you'll have the group settled and more likely to be able to hear the things that they need to. Now the back end of the session has a demonstration of skin folds. Really interesting thing, but it's demonstration only. The friends are not going to be doing skin folds. They're not going to be practicing skin folds in this part of the course at all. So it simply needs to be a quick demo saying, here's something else that's out there. If you spend a lot of time on it, you'll cannibalise time from the last part of the session, which they do need to practice. So there's 6 tests that they do in the back end of the session, muscular endurance tests and so on. Make sure you've got enough time allocated so it's divided up nicely for the friends see, hear, do. And that way they can work with each other and go right through it. Remind the friends that they're going to be needing to work with blood pressure and so on in the long run, and you're going to give them practice time in Friends Focus and give them practice time in some specific sessions where they can hone their skills a little bit more. That'll give them a bit more comfort, make them feel a bit more secure within the course. Let's look at the session run for fitness testing. The session run is Friends warm up to start, session introduction, heart rate and blood pressure before the break. Remember with blood pressure to have your sterilising wipes with the kit so the friends can clean the earpieces. They take the break, and after the break is everything else, all the way up through the roundup at the end.